Hi, my name is Leah Hartman, and I work for the District 4 Georgia Department of Health. Many of our community partners are interested in setting up their own COVID-19 vaccination sites, and the purpose of this video is to teach you how to set up a walkthrough COVID-19 vaccine distribution site. Please remember that you must follow the Georgia State Immunization Program enrollment process in order to be an approved provider. When choosing a site, make sure that your site has a large parking lot outdoors for people to wait outside, and ensure that your site has adequate entry and exit points. You want to ensure that there is adequate one-way flow. This means that there should be a door for entering and a door for exiting. As people enter your COVID-19 vaccination site, make sure that there are signs, barriers, and floor markers throughout to instruct patients to maintain a 6-foot distance. You also want to have hand hygiene, such as hand sanitizer and masks, accessible for people as they enter your site. You can set up your vaccination site to be appointment only, walk-up, or a mix of both. If you choose to have appointments, we have found that it takes 3 to 5 minutes per person from receiving their paperwork to receive the vaccine per vaccinator. Please use this information to guide how many people can be seen per vaccinator during your operational hours. Sending the required paperwork beforehand and asking people to bring their completed paperwork will speed up the process. At your site, make sure that not only the consent form is printed, but also the EUA and the vSafe information. If people do not have their consent forms printed and signed, have them fill out the consent form at your location. You can then use this information to input it into the immunization records online at the end of the day. Throughout your site, you want to ensure that you are cleaning and disinfecting the registration, waiting, and vaccination sites at minimum every hour. At your site, you want to ensure that you have enough space to have people spaced out 6 feet apart. The area you see now in this video is the designated waiting area. People can also sit here to fill out all of their consent form information. Ideally, these chairs will want to be disinfected after each person has moved on to the vaccination station. You will also want to consider having a small space where you can keep your vaccine stored to the temperature requirements that it needs. One by one, you will want to lead people to the vaccination area, making sure that everyone is socially distanced and 6 feet apart. You will want to have adequate places for people to sit and wait to receive their vaccine. The patient will hand their consent forms to the clinical staff on site. You will want to consider having barriers to ensure patient privacy. You'll want to make sure that each vaccination is being documented. All vaccines provided will need to be entered into GRITs within 24 hours of the vaccine being given. Patients should receive their vaccine cards for their personal records and additional information about scheduling appointments for their second vaccination after they have received their shot. After patients have received their vaccine, they should be led to the waiting area. After their shot, have them sit in a designated space for their 15-minute wait time after the vaccine. Patients should be observed in a waiting area for 15 minutes after vaccination for fainting or other adverse reactions. People who have an immediate allergic reaction of any severity to a vaccine and people with a history of anaphylaxis due to any cause should be observed for up to 30 minutes. Sanitizing areas after each patient is highly recommended. In areas, you will also want to manage the flow of traffic to ensure that there is one way in and one way out. You will want to ensure that there are adequate places for people to sit 6 feet apart. Your entry and exit points should be different, so the door that people exit will be different from the door that people come in. After people have waited their 15 or 30-minute wait times, have them proceed out of the exit door and back to the parking lot. Please remember that each vaccination needs to be documented, and all vaccines that are provided will need to be entered into the immunization records within 24 hours of being given. This has been a memo by the District 4 Georgia Department of Health. Thank you for your time and happy vaccinating.